through music and song, and pretty powerful there. So welcome to August. Thank you for joining us today for this Workforce Wednesday. I think that everybody can relate in some way to what it means to provide care for a loved one and the challenge that comes with balancing all the things in life while doing so. We are going to spend time today talking about the different roles that your current and future workforce fill and share some strategies about how to engage with this talent in ways that balance work, the work that's so critical to your organization, as well as those commitments that people have at home with the people that they care about. This investment in your workforce pays dividends back to you with a committed and loyal workforce who feels valued and much, much less stress. So it's a win for everybody. You can see from this slide here a preview of the sessions that we have coming up for the rest of the year. Only 1, 2, 3, 4 left, which is amazing to me how fast this year has gone. You can pop to the next slide. My name is Jessica Miller. I'm the Director of Workforce Strategy with the Minnesota Department of Employment and Economic Development, and we are very happy to have you here today. If you're returning, thank you so much for joining us and coming back. If it's your first time with us, welcome, and we're happy that you're here. Our session will go today until 12, after which we'll segue into our 30-minute unplugged portion of the event where we invite you to unmute yourself and turn on your camera and join in a conversation about whatever it is that's on your mind and what you want to talk about regarding workforce. You can ask questions of us as the consultants or our guests today that are experts in the topic that we're talking about today. So we invite you to be part of that process. That part is not recorded, just so you know, so you have freedom to be transparent with whatever it is on your mind. I would also like to know who you are. So if you want to take a second and type your name and what you do and who you work for in the chat, we would love to get to know you. We'll be utilizing our chat feature a lot today throughout our time together. Please ask questions and answer questions and interact with all of our guests and consultants and partners and each other. We really want to build upon the community that we have started here, and we welcome your engagement. Just a reminder that this session, along with all of them, are recorded. They're available to you on YouTube, on our careerforcemn.com website with our workforce strategy page, and it includes all the different resources that we link and talk about together during this time. So we have all of our past sessions as well. Our team of consultants work regionally, which means that each consultant will have a slightly different way that they do their work based on the region and the employers that they work with and all of the sectors that are important to that particular region. But the common core ways that we support employers are identified here on this slide. We work with you to identify gaps in your current strategies, ensure that you're connected with your local, regional, and state workforce partners, and we assist you in building out strategies that will help you attract and retain workforce. When you work with us, you're automatically connected to a wide network of people and partners who work collaboratively for the success of our state, our regions, our communities, so that your business and our collective workforce can thrive. We don't do this work alone. It takes many people to bring success to these efforts, and a lot of you who help make those things come true are here with us today, and we appreciate you. I know that we have a packed agenda, so we're just going to dive in, and I'm going to introduce our Northeast strategy consultant, Shayla Drake.
Hello, everybody. So as Jessica mentioned, we're talking about caregiver types in the workplace and kind of discussing a little bit about what type of caregiver types does your business recognize. I noticed I froze a little bit. So if anything happens a little bit glitchy, just somebody raise your hand and let me know. We hear a lot from employers about childcare issues and barriers to employment with childcare, but maybe sometimes we don't recognize actually how vast the impacts are to our employees in the workplaces about familial care obligations and what that really looks like. So next slide. Today, we're going to be talking a little bit about an overview of caregiving in the workplace, right? We're going to kind of review some data from some various different sources, and then we're going to move into our panel discussion with some, resources that employers can kind of tap into to help support their employees and then actually help themselves in the long run, right? And the employers that are having the barriers help the employees overcome those barriers can then in turn help alleviate some of these workplace issues. So then we'll of course have those resources that will be feeding into the chat along the way as we have this discussion. And then after that, we'll be having our unplugged session. So next slide. What is a caregiver anyway, right? Who do they even care for? So a caregiver is currently a caregiver can be caring for any of the following, right? It can be an aging parent. It can be their children or grandchildren. It can be a spouse with a severe health condition. It can be a family member with a severe emergent condition. It can be a disabled child. It can be a friend or a neighbor who requires additional support to live successfully, like out in the community. And it can be a relative who has no immediate family members, right? So, when we think immediate family, most people think of, father, mother, sister, brother, but a lot of the times we think of people that are our family, and it actually goes broader than that. And sometimes those individuals are who we're having to help support for them to be successful to live independently. Next slide. So non-working caregivers, there was an actual study put out by the Minneapolis Fed just super duper recently about non-working caregivers, and there was some very interesting information that came out of that. Nearly 14% of women aged 25 to 54 are full-time caregivers, along with 1.5% of men. You can navigate forward of that age group. Additionally, caregiving is the single most common reason people aged 25 to 54 actually give for not working currently. We can navigate 2 more clicks forward, and around 18% of full-time caregivers actually don't even have children in their homes. So when we think about it, we're like, oh, it's childcare is the only issue. It's actually a larger discussion than that. So, that's kind of where this discussion today is leading, right? It is a broad issue that people are having, and sometimes people aren't open either to the fact that they're having these issues because they don't want to put necessarily that burden always on the employer. So, next slide. There was the National Alliance for Caregiving in partnership with Caring Across Generations did a study, and they were able to put together this report that kind of gives you what they call the portrait of a sandwich caregiver. And what a sandwich caregiver is individuals that's taking care of somebody older typically and younger, and so they're in that middle. And so there are 11 million sandwich caregivers in the United States, right? And of that, 61% are female, 39% are male, right? 67% are employed. And so thinking of 67% of people that are providing care for multiple generations are in the workplace. So if you're caring for multiple individuals, that has to be impacting our work in some type of way. Next slide. So thinking about sandwich caregivers in particular, according to that the caregiving report that I was referencing, half of sandwich caregivers are caring for like caring for like a parent or a parent-in-law, right? You've got 11% that is like for a grandparent or a grandparent. Then you've got a spouse or a partner and other relatives, but you have people caring for like friends and neighbors. You think of individuals that are, maybe they haven't had a family at all, or they're, they don't have anybody that can help take care of them, and they maybe don't have a lot, but you've been neighbors for a long time, or you've been a friend of their family for so long, and now you're a surrogate family member to them. And so you're providing and they're providing and taking care of those individuals. These instances, if you actually look, are higher than individuals having to take care of a spouse or a partner or a grandparent or a parent-in-law, right? And so when we think of like FMLA policies and all of those things, it doesn't cover some of those situations. Next slide. When we think about the stress and the strain and the impact on a caregiver, and they're rating it, right? Like, how much does this impact, stress and strain? When you're rating it on like a scale of like, 1 to 5. 33% are giving it a 4, 5 to a 5. And 20% are giving it a 4 to, so it's like, if you're sitting here and saying, I'm getting a high emotional stress, 4 out of 5. 20% financially, 4 out of 5. 20%, it made my health worse. So when you're thinking about how can I support people to make it, make what they're having to do on the outside world a little bit, not grease the wheels, but making it better or easier for them, what can I implement, or what can I do to make the things that are impacting their outside lives a little bit easier, so that they will come to work, so that they're not having to call in, so they're not having to miss days off. Because if they're emotionally strained, they're financially strained, their health conditions are worsening, and they're tired all the time, how well are they going to be able to, be effective and productive in the workplace? Next slide. So then we think about, do they even need help? Do they even need help? So when asking, do you need help? Are you out looking for help right now? Or are you out in the community seeking supports and services, or are you good? Right? So when they're asking these, 85% of people providing cares for other individuals, 85% say, I need help. I am on this island. I need help. Somebody help me. And it can be a varying things, right? If you're caring for someone at home, it could be end of life decisions, medications, if it's childcare issues, right? And it could even be if you're a second, English is a second language, it might even be finding educational materials, right? It could be a vast myriad of things depending on those individuals and the environment. But again, it's having those discussions to find out what people need. But 85% of caregivers are out there trying to find things that they need to provide the cares that they have to provide. So next, we're going to talk a little bit about the impact on the work that is kind of I think the biggest part of the discussion and why we're here. We can talk all day about, yeah, we understand taking care of someone else is hard, but we, it has to be done. Well, as an employer, why should I even bother? It's all, we talk about business, it's all about money, and a lot of times it's like all about the bottom line. Well, if it's impacting their workplace and it's impacting their productivity, 60% says it has some type of impact on their work. 40% of employees say, you know what, I'm able to make it work no matter what, I'm able to do it. I'm able to just, no one knows, I'm able to figure it out. But the other 60%, and we talked about it, there's out of those 11 million people, like 67% of them are employed. So 67% of those 11 million people, 60% of those are having an impact on their workplace, right? So that's going in late, having to take leaves of absence, going from full-time to part-time, right? Giving up work entirely. retiring early, losing losing benefits at work because of having to cut down on hours. So there's all kinds of reasons why there is an impact on their workplace because of having to take on caring responsibilities. So the last kind of real piece that I want to touch on, and I think it's a perfect segue into our discussion with our panelists today, is the increase in the prevalence of caregiving, right? So just from 2015 to 2020, caregiving has increased, right? So we think of people receiving care, which 0 to 17, so that's child age care, has increased from 18.2% in 2015 to 21.3% in 2020. And caregiver recipients over the age of 18, so that's going to be an individual with medical conditions or older adults or any of the above. So all of those categories combined has increased from 16.6% in 2015 to 19.2% in 2020. So it doesn't matter across the board from children to people with disabilities to older adults, there's an increase. Caregiving across the board, there is an increase. And then we say, okay, well, there's all of these people that are requiring more care, having to be cared for. Are they getting the help that they need? And how easy is it for them to get the help that they need? They also ask the question, well, how easy is it for you to navigate care, coordinate services, or find the help that you need? From 2015 to 2020, there was an ease of coordinating care question in there. And it went from, you can kind of see there's this 18 and 5% because there's this difficulty scale where the red is, the 18 and 5 in 2015 to 24 and 6 for the most difficult. So even the difficulty in navigating systems to coordinate care. So like I can't even figure out the basic necessities to how do I secure a spot in this facility for my loved one, or how do I get a childcare spot for my 0 to 2-year-old in this center. I have no idea how to even get childcare assistance or whatever it may be. So individuals are at a loss because navigating systems is becoming more and more difficult for individuals. So with that, I'm going to introduce our panelists today, because I think this is a great discussion. And with the impacts on the workplace, having professionals like these that are willing to talk and help employers, I think is invaluable. So we've got Maureen Kennedy. Sorry, why did I put a D in that? We have Maureen Kenny from she's the Live Well at Home supervisor with the Minnesota Department of Human Services, and the Minnesota Board on Aging. She joined DHS in 2022, and her job at Live Well at Home focuses primarily on the intersection of family and friend caregiving for older adults and supporting policies and programs that maximize the independence and health of well-being for those caring for friends and family. And she has extensive prior experience in nonprofit leadership within home and community-based services. And she holds a Master's of Public Affairs degree from the HH Institute of Public Affairs. And then we have Matt Carlson. He's the Childcare Capacity Building Coordinator at Childcare Aware Minnesota, coordinating the Childcare Wayfinder Initiative. It's a statewide network of local navigators who help individuals and organizations with starting and growing childcare programs. So in this role, contributing to statewide efforts to increase childcare for families in Minnesota. And then we have Leah, with to the Childcare Startup and Retention Navigator with Childcare Aware Minnesota for Northeast Minnesota. She accompanies new and existing childcare programs, and in the Northeast region, licensing, funding, and more related to starting and sustaining and expanding childcare. So with that, we will move into our panel discussion. All righty. So I covered a lot. I covered a lot in the beginning of the presentation, about like who a caregiver is and who they care for and how they're impacted and supports. And with all of that, um, with the prevalence of caregiving increasing and difficulties navigating services, I'm just excited that you all are here today to kind of talk about this with the employers. I look at Workforce Wednesday as an opportunity to let the employers kind of see what there is available, for them to tap into and, hopefully take back to their workplaces and see what could be relevant for them. So, um, I think my first question for Matt and Maureen, maybe I'll have Maureen go first, would be, can you give us maybe just like a brief overview, couple of minutes of maybe your program opportunities, at your organization, or maybe or others specifically that you're aware of that highlight promising practices specifically for caregivers, attending, that employers that are wanting to help caregivers that might be attending this session.
Sure. Hello, everyone. Um, I'm going to launch off with just a reminder. That presentation was awesome. That was amazing. And in my role at the Minnesota Board on Aging and Department of Human Services, we see anyone who is helping an aging parent, spouse, friend, or neighbor as, and not paid for it, as a family and friend caregiver. I want to note, though, that we also really recognize that caregiver may not be a term that the person engaging in these tasks will resonate with today or ever. They see themselves as a spouse, as a daughter, as a neighbor. So as I share out today, just want to be really intentional about not labeling an individual that are doing these tasks, but really talking about the impact that providing these tasks and these responsibilities have on the individual, the employees, and the employer. So at the Minnesota Board on Aging, we have a couple of resource guides. One is specifically for employers. And in it, it really talks through how do you begin to have a conversation within your organization about setting up resources and supports, what you should look at. So there's 3 different tracks depending on the size and scope of your organization. This resource guide is available electronic. I also have actual printed ones, which you can't see in my background. Um, in there is also a list of resources. So other national organizations that also have toolkits. So basically, I would encourage everyone just to take a peek at it, look at all the resources mentioned, because chances are there's going to be a resource or a toolkit that will bring value to the conversations you're having about how to make your workplace a more caregiver-friendly workplace. Um, on the caregiver side, so we also have a resource for employees, but those resources are also in the employer guide. And those are resources specific to Minnesota. So we have minnesotahelp.info, which is an online database of a number of resources across Minnesota that you can go on and, enter in caregiving or, different types of tasks. It'll pull up resources. There's also information about the senior linkage line, which is a place that you can call and just say, you know what, I'm full-time employee, I'm caring for my mom, I need help with, and they can direct you to different resources. And those resources, part of them are resources funded through some federal dollars passed through our area agency on aging. So we have 6 area agencies on aging across the state of Minnesota, covering the whole state. We also have one that is focused on the tribal nations, and they subcontract with providers who do direct caregiver support. So there are 56 funded providers across the state of Minnesota who are doing support groups, education, direct caregiver consultation, helping caregivers link to resources. So I guess just in summary, these resources will say how to guide you on how to establish a culture and an organization that is caregiver friendly. with some national resources, but also link you to folks in your community, providers in your community who, when a caregiver calls and they need to find a resource, they're not calling a national tip line. They're calling a local service provider who can say, this is what's available in our community. So I think that's really important, because the last thing stressed out employed caregiver needs is to make multiple calls and end up with information that's not truly relevant to them.
The
So
circle,
the circle, right?
yes.
Right.
Yeah, and I think that's at least I know that's huge for people that utilize that resource to be able, there's one number I can call, there's one thing I can call, there's one, person that I can contact to say, okay, this is my dilemma. And they can be like, okay, this is who you're going to contact, or this is the agency you're going to reach out to, or this is the service that you need to contact. Because it almost is like a mini triage situation. And I think it is absolutely phenomenal. But a lot of people aren't aware that it's beyond just calling to find out what beds are available locally or that kind of thing, right? Like there's a misconception.
Sure. And one thing in the charts that you showed, the one thing I noticed missing, and that's the distraction. It's a caregiver at work, one of your employees who's providing support and care for someone, and they need to call someone at a certain time. They need to do something on their break. That distraction is impacting the work that they're able to provide. So again, getting relevant resources available to them can really decrease that distraction so they can be focusing on work when they're at work, and know that their needs are being met, to reduce that stress and worry.
Absolutely. So Matt, same question to you. Can you give us like a brief overview or highlight of kind of what childcare aware is, childcare wayfinder, the new that kind of program, like what that is specifically from like an employer lens or that kind of, yeah.
Yes, happy to share and very happy to be here. Thank you for inviting us, and thank you to everyone who's here to be part of the conversation. I think it's really important for us all to be thinking about caregivers in the workplace together. So we'll start, as Shayla requested, with a general overview. We, myself and Leah, work for an organization called Childcare Aware, which is a statewide network that supports our childcare providers, offering coaching and training and funding to keep our network of childcare providers strong. Leah and I also focus specifically, we work for a program called Childcare Wayfinder, which focuses on starting new childcare programs and supporting those who are already licensed to continue their work and to expand when there's potential for that. So we're very focused on increasing the supply of childcare and increasing access to childcare for families all around Minnesota. And as Shayla mentioned, in addition to working with those individuals who want to start childcare programs, we're very open and welcoming to any organization that wants to get involved too. And that's where Childcare Wayfinder can specifically support employers that are interested in some possibilities for providing more direct support to their employees when they're seeking childcare. I think a little later in the conversation, we'll get into some of the details of that. But for now, I think it's enough to tell you two broad directions we take. One is making sure that you have the information you need to help your employees find and pay for childcare. So we'll make sure you get connected to another team at Childcare Aware, which is part of our Parent Aware initiative. We have a team that is available to help any individual that's struggling to find childcare. There's a phone number to call, an email address to be in touch, and you can talk directly with someone about the possibilities for childcare in your area. So we want to make sure employers know about that and can connect their employees. And we have other other information that employers can draw on to think about what's best for getting employees the ability to pay for childcare as well. So Childcare Wayfinder helps get programs started and can help employers get involved in that process. Parent Aware helps your employees get connected to information about childcare. That's what exists at our organization, Childcare Aware. I wanted to mention just one other important organization that we work closely with, First Children's Finance. They organize community conversations and plans to address at a community level childcare shortages and solutions. And I know we have some business development specialists from First Children's Finance on the call. Um, our staff can help you get connected to the conversations that are already happening in your areas, supported by First Children's Finance, which are made up of community leaders, including business leaders, thinking about how to address the problems together.
Fantastic. So I don't know if this is me being nosy or just interested, but because, your organizations focus a lot on, caregiving in general term, when you think about your individual workplaces, you're helping, do outreach with employers within your organizations. When we look at, and we'll probably get into this term a little bit later, but what would be considered a family-friendly workplace, would you consider your workplaces to be what would be considered family-friendly workplaces? Are all caregiver types theoretically recognized, like friend of the family having to care for and those kind of things? Or would you say many, if not most, employers probably have room to expand definitions? This is a whole group, because this is one of those things where I know a lot of employers, even the ones that are leading the discussions and leading the charges, probably can still see gaps for expansion, just by the change in demographics and the change of what we're seeing and services being provided, right, in the different areas. So that's just, I think, like a group question that I wanted to ask, just because of my own interest in seeing some of these studies and the people being cared for. Any thoughts?
I'll jump in. So I work for the state of Minnesota, and as in my introduction, I've been here for a year, and I think the environment I work in is very supportive for family and friend caregiving. Still learning about the intricacies of the state of Minnesota, having come from the provider side. So I worked in home and community-based services for much of my career. So I have seen a number of different organizations and have worked in this caregiving space for quite a while, and did some work to help employers do an assessment on how well they were supporting their employees who were engaged in caregiving tasks. And it was really interesting to be working with other employers while also looking at my own employer and going, well, now wait a second. So I always believe there's room to grow, always. And what I will say personally, I have learned through my professional experience is that what I'm learning today in the last year and a half, learning is that to for employers to have banks of resources, websites full of lists of helpful information and whatnot, that's not necessarily what those employees need. They need flexibility.
Mm-hmm.
They don't need someone to tell them how to care. They know how to do that. Not saying that all those resources aren't valuable. I mean, if you can find what you need in a one-stop shop, that's great. They need permission. They need to be able to make a decision that they need to do something right now. for themselves related to stress, for the person they're caring for, and to have the flexibility to do that. And that's really challenging to think through and plan for any business because you can't anticipate what everyone's going to need. So it really is shifting the focus from, okay, we're gonna do lunch and learns and we're gonna have, this EAP, all these services. How can you also look at that flexibility piece to empower the caregiver to do what they need, um, to be the best that they can in their caregiving role? And that's going to evolve. It's never going to be done. It's always going to evolve.
Just like any workforce strategies, right?
Exactly. Yeah.
So I think I'll just keep this question for you to you. So let's say an employer reaches out for you, Maureen, and they're like, I'm really having a lot of my employees specifically are having issues with elder care supports, right? And I just don't know what to do. Like their specific issue is they're having trouble with navigating in elder care systems and elder care support. Like, and they reach out to you, like, what would you do? What would that look like? What would you recommend to that employer that's kind of just like in that situation, just because if that's their employee base, what would that kind of look like if they reached out to you and just kind of was like, that was their dump to you?
Well, I would thank them for reaching out and trying to do something different. In my role and our team here, we're not really in a direct consultation or direct service sort of position, but we are connected to a lot of people who are. So I would learn more about what they're looking for, where they are, where their employees are, um, and then share the resources, certainly, which I've already overviewed. There's a lot of organizations doing good work around supporting people caring for older adults. I'm going to stay in my lane. Some of them are AARP. There's a whole host. So I would learn more about their particular situation and then connect them. And so not just sending them a brochure or these resource guides, but actually try to link them a warm handoff to someone I know at another organization. And if it's in a part of the state that I'm not as familiar with the resources, I would connect them with the area agencies on aging or some of the bigger providers. Again, I really think that local connection is important. So that's what I would do, which unfortunately, I can't do that direct sit down, help them map it out, but really try to help them find people who can do that with them.
Right. And that's the thing is there are people who can, right?
Right.
And those resources are available and there are ways to get there. There are paths to get there. And that's the thing. So and kind of same question though to you, Matt and Leah, what does it look like if an employer calls and they're like, oh, we really want to do something with childcare, but we don't know even where to start or what to do. But we don't want to be a childcare business. We want to be our business, but we we need help. But we need to do something. So what would that look like in your realm?
Uh, we would begin by assessing a connection to some of those resources that I mentioned earlier. So we'd find out more about what the employer's HR departments are currently offering to employees in terms of information about childcare availability, information and education about childcare tax credits and deductions, that sort of thing. And we do that by connecting folks to our Parent Aware Childcare Information Services team. Then we would talk about some of the possibilities for planning, funding, or operating childcare programs if the employers are interested in taking that next step in. And finally, we would check to see what sorts of connections they have to other employers in their communities, to groups of community leaders that are gathering together to think at a community level about uh, possible solutions to childcare shortages, especially in direct connection to our colleagues at First Children's Finance. Those are the pathways that we would take. I'll let Leah say a little bit more about what that can look like in some detail, working directly with employers.
Sure, yeah. So I get to do that direct connection with employers. And so it's really exciting work for me because my focus is on building childcare capacity in our communities. And I know how important that is for employers who are looking to attract employees. And so um, what I do on the ground is meet to discuss the scale of the need for the employer, like how many childcare slots are needed and what kind of involvement the employer wants to have. Like, do you want to start a childcare on site, or maybe you just want to um, subsidize a few slots at an existing childcare program. And so, for example, I'm working with an employer right now that needs to attract over 300 employees. And so they want to start by supporting a small center with construction with the startup, and then offering tuition subsidy for several slots so that those slots can be held for their employees. Which is really important because the availability of childcare is so narrow. And then I continue working with employers along the way, connecting them with childcare providers that they can partner with already in the community, or finding a new childcare provider who is interested in starting up and partnering with the employer. And then kind of working through all the different possibilities to support childcare in the community through in-kind donations, financial assistance for things like construction and remodeling. And I mentioned subsidizing the tuition for slots. It's really important for childcare businesses to have revenue that they can depend on. And so getting that directly from local employers can be really helpful in the childcare world.
So I want to keep you here for a minute, Leah. I'm really interested in kind of the, assisting in navigating the options for the employers, and how, in depth they want their relationship to be. So let's say an employer, decides they kind of want to dip their toe in a little bit, or maybe they want to really jump into it, but full on regulatory fear, right? They're like, I want to do this, but it terrifies me. What does it look like having a navigator assist or kind of walk through the process? Is it, here are the regulations that you must follow, and give them those, again, like fact sheets, information for them to chase that down? Or is it an assisted process? Kind of what does that look like for the employers, especially knowing the amount of regulations that there are in childcare?
Well, it's definitely a tailored experience for what the employer is interested in. And so if there's a lot of fear around regulations and like licensing and things like that about childcare, maybe starting your own childcare center on site as a part of your business isn't the right route to go. And so I can, and my fellow navigators can help kind of choose the right path and guide the employer along that path. Um, so there are lots of different ways to get involved and to help find creative solutions for childcare capacity.
Awesome. So I think I'm gonna turn this one, I think, to probably, I'll keep this along with both Leah and Matt. So when it comes to, I know we talked a lot about, you actually listed off quite a few different examples of possibilities for employers, from sponsorship of slots, creating their own slots, different supports, community supports and subsidies available, tax credits. What have been some of maybe the more effective strategies that you have seen for supporting caregivers, at least maybe either regionally or statewide or in your areas, or more frequently used and effective that you've noticed?
I'll start by saying starting small, really emphasizing what Leah said. The idea of creating a childcare center operated on site is fantastic. And when it's possible, we love to see that. And it's quite an undertaking. So starting small, I think taking a first step in by establishing a partnership with a nearby childcare center or a home-based childcare program, and sponsoring the spaces at that program and connecting your employees to the program is I think a straightforward and easy first step that can grow into bigger partnership. I think that's one that feels especially great when we see that happening. Leah, you want to add any others?
Yeah, I think another really excellent way just to kind of dip your toe in is through in-kind contributions. Um, really simple things like sharing custodial services can have a huge impact for a childcare center. Um, or even administrative support. Some of that back office support can be huge for childcare centers or family childcare providers. So those are great ways to support childcare providers in the area. There's also ways that you can get involved with community groups. Matt mentioned a couple times the First Children's Finance community groups that are finding creative solutions, and those are excellent to be a part of, or even smaller work groups around a particular childcare center or family childcare. I know I'm working with one in International Falls right now. The childcare center wants to expand, and so we're forming a committee of local employers and other stakeholders just to make sure that we're meeting their needs and that everyone in the community is benefiting. And so simply being involved in work groups like that can have a huge impact.
Absolutely. So I want,
Could I
oh,
add
I'm
one more
sorry.
thing, Chair?
Yes.
So I think that being involved in those community groups can expand then into broader advocacy efforts, and we really need employer support there to address some of the root causes of childcare shortages, including advocating for policy changes that I think would benefit employers, increasing tax benefits to employers who want to participate in finding childcare solutions. We put a link in the chat earlier to the Minnesota Business Vitality Council's report. I think has some great information for any employers that want to think about getting involved in advocacy efforts.
Fantastic. Awesome. Anything else to add for that question, Matt or Leah? I don't want to cut you off. Okay. So basically same similar question, Maureen. What has been the most effective strategy that you have been able to see employers utilizing to kind of support their workforce when it comes to caring for our older adults or people with disabilities, right? That they're having to care for.
I personally have seen the most success when there's someone in leadership who's championing the conversation. So that real life experience of what it's like to have a career and also be providing care to someone brings a whole different lens to what is possible. I've seen that be very successful in small businesses where the owner has been or is a current family friend caregiver. And so they try to create a culture of that flexibility, of a lot of self-care, providing meals or healthy snacks, really promoting wellness in the workplace, and also the flexibility to adjust schedules, do the hybrid. We've learned so much during this pandemic about how we can work differently. these small businesses were doing this before, really allowing that flexibility for their employees. I've also seen larger organizations. One that comes to mind was a health system that was providing care to patients and their caregivers in as part of their customer base. And they really recognized that so many of their employees were family and friend caregivers. And as they were building out services and supports for the clients that were their business, they they intentionally spent time to survey their employees to understand how many were engaged actively in caregiving, and developing a parallel structure on wellness and resource availability, which to me, um, that showed a genuine concern about their patients and the family friend caregivers, because they also were concerned about their own employees who are engaged in the same. Um, so it really, and again, this was championed by people who had personal experiences, who got it and really wanted to honor, and it's a business decision too, to recruit and retain employees. They really wanted to support them. So those are some, and really, as much as I think there are things to learn across all of the examples, it really is individual, really looking at what the business is, what the daily operations are, and really looking at equity. I have a feeling it'll come up in a later question, but if you're a business that has hourly direct service employees along with a salaried professional, you can't just offer that flexibility to part of the organization, um, if that's not available to hourly direct support, direct care teams, because that will create a tension, and I've seen that happen. So it's not one size fits all. That cliche, it really, I have seen it work well, but there's learnings along the way. Even all of these businesses that I've had the opportunity to learn from or work with, think they're starting out on one path, and it changes dramatically as they learn more and get the reaction from their teams, from their employees, and what is relevant, what's working, and what's not.
Yeah. Absolutely. So we have a couple of minutes before we're going to do a quick wrap up and switch over to Unplugged. So I want to ask one quick question. We've kind of probably touched on bits of this in the last question, but I want to simmer it down. What is the one piece of advice or key takeaway that you would give to an employer from this session that's on this call today? We can start with, since I'm going to go like left to right based on who's on my screen. We'll do Maureen, then we'll go Leah, and then we'll go Matt. So one piece of advice, key takeaway that you would give to an employer.
I would focus on awareness, that just understanding that your employees are caregivers. So it does matter to your business, and really focus on understanding that, and it needs to be understood at all levels of the business, that the impact that a person engaged in caregiving can have on the workplace, and how the business can listen and learn and engage their teams in creating a space that's going to be supportive to them, because the rewards will be tremendous, I believe, for their business.
Leah?
Sure. Since I focus so much on availability of childcare, I think I want to focus on how the cost of caring for young children is really high, and the childcare business model really just doesn't work. So these childcare businesses struggle to stay open, to be able to provide care to the children in the community. And so if you, as an employer, want to attract and retain employees who may have young children, it's in your best interest to invest in childcare in your community in some capacity, whether that's with your time or some sort of financial investment through slots or any other way that you feel would be appropriate. Uh, it's it's a tough business. Childcare is a tough business. I'm on the ground helping these providers every day, and um, without some additional support, it's really hard to make it. So that's my number one takeaway.
Awesome. Matt?
I'm gonna emphasize what Leah said with I guess just a clear message that we need employers working on this with us. Childcare is important for every community, and the impact that it has on employers is direct. So we need you to help us find solutions to the problem, but we also know that, like Maureen said, and like Leah said, you'll feel the impact of those solutions right away on how your employee caregivers are able to show up for their job, show up consistently, show up not distracted, and know that their kids and other loved ones are cared for.
Awesome. So with that, we're going to wrap up this section of the panel discussion, and we'll share the slides really quickly for the last couple of pieces. We have just a couple of slides left. Just fly through to the resources slides. Most, if not all of the resources have been put in the chat, but also the presentation will be in the archives. So anyone that's interested in the resources, they will be available in the Workforce Wednesday archive shortly, hopefully within the next week or so, maybe two. Hopefully it doesn't take that long. But go ahead and advance forward. With that, I will turn it over to, I believe it's going to be James.
Indeed. Shayla, thanks. This was a great conversation, and so many questions have come out of it. I mean, I wonder what the impact is going to be on children for generations to come. Like I think about, like we talk about like latchkey kids, right? I was one of those, and like what the impacts were on our society based on that experience. Again, my brain is racing. This was a really great conversation. So, but if you enjoyed this conversation, if you enjoy Workforce Wednesdays, please join us next month, specifically September 6th, we're going to talk about leveraging second chances for a better workforce. We're going to bring a panel of experts in who are going to talk to us about how we can engage with this marginalized and often underemployed population to not only benefit our organizations, but to provide a higher quality of life for people who are just trying to get back on track and be members of our society. So again, September 6th from 11 to noon, just like today, from noon to 12:30, we'll do our unplugged session, which we're going into right now. So be ready for that. We'll ask you to go ahead and turn on your microphones, turn on your cameras, speak up, speak out, talk to the group, and let's just continue to have this really fun and great conversation. Also want to remind you that we have resources on our Workforce Wednesday website, like Jessica mentioned. So if you want to see recordings from previous Workforce Wednesdays, you want to look again at that agenda for the future Workforce Wednesdays, or you just want to look at some of the resources and assets that have been shared, not only today, but at previous Workforce Wednesdays, please, please, please visit that website. And last but not least, before I send it back over to Shayla to close us out and talk about caring careers, we're going to ask you to complete a survey. We're going to send this out at the end of today. It's also going to be in the chat. Those surveys help us tighten things up, make sure we're delivering a valuable experience to all of you and giving you tools and assets that you can utilize as soon as possible to change the culture and workplace. And then last but not least, those surveys help us decide those topics that we're going to decide or talk about or bring panels together to talk about for 2024. So again, please fill out those surveys. Let us know what you think. Let us know what you're curious about, so that we can follow that trail. So thank you. Thanks, Shayla. See y'all next month.
So with that, any employers that are on the call that fall within the home and community-based service providers category, if you haven't heard, hopefully you're hearing about it now. It's Follow Your Heart to a Caring Career campaign. It was June, July, and August is when the campaign is running. End of August, you still have a chance to participate in the active portion of the campaign. It's where we were reaching out to hopefully active and inactive job seekers to try to get them interested in a job in caring careers. So when we talk about caring careers, it's home, facility, and community-based care providers. So direct care specifically related to those positions. So next slide. And we have a lot of ways in order to engage using the hashtag, letting us know about any activities, recruiting, or marketing events that you have going on related to awareness to your site, specifically career exploration, job shadow opportunities, that kind of thing. Let us know so that we can get the information out and let people know about those opportunities. And with that, we thank you. We're going to switch over. We were going to change the settings so that you can turn your mic and your camera on and ask a direct question if you like. And we're going to turn it over to Adeshewa, who is going to be leading the Unplugged from here.
Thank you, Shayla. Thank you to Maureen, Matt, and Leah. Like James said, this was a really good discussion.